What's up? I have 14 places where you can work at as a certified nurse assistant. I have 14 places that we can really work at. The first one could be travel or temp service. The VA, more like a VA clinic niche for the veterans, or hospital settings for the veterans. Also a county, wherever county you live in, you can work in that county. More so the mental institution or jail niche, like that. Hospice. You can do hospice care, maybe 1 or 2 patients throughout the week if the pay is right. So you're only caring for that one patient on that different day. Probably he or she giving them a shower, caring for them, interact with them. That's more of a so also too going with home care, that companion, that one-on-one time. You in their home, so you're doing a light cleaning, washing dishes, make sure to remind them taking their medication, probably cooking them something, doing a load for them, sit and talk for them. Only there for them that 4-hour niche for home care. Long-term care is long-term, so nursing home settings, assisted live like a skilled settings, or acute care settings, or rehab settings, or dementia settings, all-time settings. So it can be a variety of settings for long-term care. It can be geriatric. So different units of that long-term care can be a variety of patients that you are dealing with for long-term care or skill settings. You can also work in school, like right about now. You can also work in schools, but you also work with school as in for children. More so in private schools or MPS schools need CNAs for helping too, because the teachers cannot take them to the bathroom. Private duty, you with that client for that whole 8 hours or 16 hours. They could be in a nursing home or in their own home. That's almost the same like a home health care too, Panish. Private duty, adult daycare. You gotta do adult daycare with them. Adult daycare is the more adult daycare or group home settings, like that. Adult daycare in a group home settings is where the patient or the client going to another facility, something for they can do. It's like more of their work ethic, or something to keep them occupied since they need to keep moving. Or the person who owns that facility of that group home or that assisted living, on that group home or the adult daycare, need more clients to assist them. Of course, maybe 5 or 4 clients, depends, one-on-one. Same thing, Hoyer, toilet them, assist them with feeding, stuff like that. It's like a minimum assist. Assisted living and group homes, I kind of put them together as well. So assisted living depends on the settings, how big is the facility wise. If it's a single family house, maybe a 4-bedroom, you taking care of 4 people in one household. But you cooking, passing medication, doing laundry, light cleaning, interact with them, charting on them, taking different activities with them. Hospital can be a different settings. A hospital of the ICU or the ER or the cancer unit. Hospital we can work as for CNAs or acute care, more of a rehab settings or geriatric rehabness for the clients. I kind of went through that. It's different levels of we can do for all of these. The workload can be different, or we can just work by ourselves, so we in and not out it. For hospital, there's a 8 or 16 hour, a 12 or 16 hour shift. Most hospitals I've been through do 12, or you can do 8. Assisted living, you can do 8 or 16. Group homes, it's the same, 12 or 16 or 8. Home health, a 4 or 6 hours. Adult daycare, it can be 8 hours also as well. Private duty, it depends on that client needs you in that time frame. School from 7 o'clock to maybe 3:30. That's when school out. Long-term care, for long-term, 8, 16, 12. Depends on the time, what time that time of the facility start, as in shift-wise. Hospice, you're going to do 2 or 4 hours. It's almost like a home care niche. They fit in that range. Depends on that client and how fast they going down. Mental health, again, it depends on the facility wise. The shift, it can be first, second, or third. The times can be different. The VA is almost the same. Temp service, you work when you want to work. Also, you can do apps, different apps too as well. But temp service, you work when you want to work, or you pick up shift when it's available for you. It's convenient for you. But this is your girl. Click to leave a notification. This is your girl, Tanya, and I will talk to you on my next video. Bye bye.